This is a classical picture of carcinoma bladder with high definition camera. You can see the small venules also on the tumor. If you go close in the right side of the bladder, this is a tumor. This is the classical picture of a transitional cell carcinoma of bladder. You can see the calcifications also on the tumor, which is not a good prognostic sign. These are the vessels which are supplying the tumor. Now we will cut the tumor with bipolar. The advantage of bipolar is current will not go outside this is the ureteric orifice. So it is nearly 2.5 centimeters above the ureteric orifice. Entire bladder we have to inspect. This is the opposite side ureteric orifice. And after inspecting the entire bladder, now slowly we will start cutting the tumor. Now we are inspecting the entire bladder. So now we are inspecting the left lateral wall and we are inspecting the anterior wall. Sometimes we empty the bladder to detect the same. Now this is the bladder neck, and this is the, you can see the air bubble. Somebody is pressing so that we can see the tumor whether it is there or not. Now we will start resecting the tumor. So you can see that small lesion. Now we will start resecting the tumor. We will activate and we see, you can see nicely it is a very beautiful equipment, bipolar, where you need not worry about the current going into the outside the bladder. It nicely resects and removes the entire tumor. This is the way it clearly cuts. You should have perfect control. If you go deep, bladder can be perforated. So you have to see the edge of the bladder wall, and from the edge we have to remove the tumor completely. Slowly from the edge, whenever we are removing the bladder tumor, it should be in collapsed state so that bladder will not get perforated. You have to remove entire tumor carefully, and at the end you have to do coagulation. In between, if the bleeding is coming, it is difficult to coagulate. You have to remove these fragments intermittently, otherwise they will stick. Unlike in prostate gland removal, this is the core center of the bladder tumor. Sometimes when the vessels are more, we will coagulate the vessels also. At the end, the bladder mucosa should be free of the tumor, and the tumor should be completely removed, and all parts of the tumor should be removed. From the edge only we should see and coagulate the tumor.